Thank you, Caroline, and thank you, Penny, Karen, Andrew and Leanne for all that you've done to put on this day. I think it's going to be a fantastic day, and I'm really delighted to be given the opportunity to come and speak to you today. Like I say, hello, my name is Steve Dunn. That's important. We all know why we need to say that, but I'm the new Chief Exec at West Suffolk. It's week 2, day 9 if you're doing a 24/7 week, and I have been in over the weekend, so I have started with gusto. And if you want to see what I've been up to, do take a look at my tweeting. I would like today to explain why I believe and why I support and why I think health coaching will help health systems and hospitals be sustainable for the medium term. I'm a local person. I live 20 miles away. I live in Norton, just outside of Bury, and my family use the West Suffolk Hospital. We are fully embedded in the West Suffolk system. I've got a local GP. I understand the award-winning care that goes on in Suffolk and beyond, and I think it is a great local hospital. You know, there are committed staff who deliver high quality, safe care, you know, week in, week out, and I've really seen that last week. So I'm really grateful for the opportunity, for the privilege to lead West Suffolk. But we face some really big challenges over the next few years. We all know we're seeing rising demands in the health and social care system. We all know that we're seeing flat and falling budgets right across the piece. The population, though, that we serve is ageing, expectations are rising, technology is rapidly advancing, and costs and public expectations will just continue to accelerate over time. Now, we think about, say, the population of West Suffolk. Well, it's projected to increase by 7% over the next 10 years, 7% over the next 10 years, and a 38% increase in the number of people who are aged over 70 years old. We know what the big killers are. It's circulatory disease, it's cancer, it's respiratory disease. We know cancer is the leading cause of premature death. We know that by and large West Suffolk's population is a pretty healthy population with average life expectancy just over 80 years for males and females, but we equally know there are pockets of deprivation and ill health that we need to address and target. So this population, this context is going to put real pressure on local services. Now we know nationally that the number of people with 3 or more long-term conditions is going to increase over the next 10 years from 1 million to 3 million, or just under 3 million, 2.9 million. And we know that three quarters of all deaths will be as a result of chronic disease by 2020. We know that long-term conditions accounts for around 50% of all GP appointments. 50% of all GP appointments. We know that 70% of inpatient bed days and 70% of overall NHS spend is caused by patients with long-term conditions. We know that 70%, again, of premature deaths are caused by behaviours that can be changed. And over the last few weeks, I'm sure if you've been paying attention, you will know that in terms of diabetes care, West Suffolk, across primary and secondary care, can do better and is providing care that's amongst, shall we say, the most challenged if you're being polite, perhaps the worst if you're being impolite in the country. So that's a big challenge. So we're facing a frail, elderly, more demanding population that's got a variety of health needs that, if poorly managed, is going to result in unscheduled admissions to hospital, and that is a situation that the patients don't want and the hospitals can't cope with. The pressure is already being felt at West Suffolk. West Suffolk Hospital is 6.3, or projected to be £6.3 million in the red this year. And if current trends continue over the next 5 years, we are projecting that West Suffolk will be in the red for the next 5 years. And that will raise in many people's minds a question mark about the future sustainability of West Suffolk Hospital. So we're going to need to do radical things to ensure the sustainability of West Suffolk. So I think one of the key objectives for West Suffolk Hospital will be to shift increasingly into prevention and earlier intervention. We will need to change the business model from necessarily treating people who pitch up at the hospital to increasingly trying to keep people out of hospital. Now, over the last week, speaking to several clinicians, both in and outside of the hospital, and several GPs and consultants and nurses and allied health professionals, it is quite clear to me that progress is being made in West Suffolk. We've got the early intervention team, which is doing great things. We've introduced the comprehensive geriatric assessment service, and we've innovated in stroke care. And this is increasingly what patients want. But we're going to need to go a lot further and a lot faster. So we need to make West Suffolk sustainable, and we need to make services in the broader context sustainable. And that, I think, will increasingly mean tapping into what Simon Stevens, the new Chief Exec of NHS England, or well, maybe not so new now, it's 6 months on, is called the renewable energy of patients. And I'm sure that's something that Pete Moore will talk about a little bit later. So I think this is where health coaching can make a real difference. So what is health coaching? Well, I think it's about, to me, it's about talking to people to help them better manage their own long-term conditions in a way that supports them, empowers them to better manage their own care. And that allows them to fulfill their own health goals and to improve their quality of life, which is ultimately why we get out of bed in the morning, which is why we're in the health service. Now, if you think about what happens at the moment, in many situations, we find the context whereby both what patients want and what they get is not always aligned. The goals of patients are not always given the right recognition in the way that we treat and interact with them, and the benefits of shared decision making and patient and carer involvement are not always being realised. We don't always harness the untapped energy of our communities, of our volunteers, and we can do so much more to help people live with their conditions and manage their health care better. So I believe quite strongly as healthcare providers that we need to realise the opportunities for harnessing patient power to make services sustainable, but equally and most importantly to drive up the quality of patients and the public's quality of life as they increasingly live with long-term conditions. Now, in other industries, in other parts of the economy, we have seen increasingly customers used to strongly improve the service offering to the public. We all know about the transformations that have happened in retail banking, in communications and retail. We all know about IKEA and banking online, and increasingly customers are routinely delivering value to themselves that had previously been delivered by paid staff. We bank and shop online, we assemble flat pack furniture. There's been a massive transformation in the way that we improve our lives. Online banking, it's more convenient, it's easy to do. You don't have to, as I used to do when I was growing up, have to go into the town to go when the banks are open. Increasingly you can do it at a time and a place when it's convenient to you, and you can get on with your own lives, which is ultimately what people want to do. So I think there's lots that we can learn from other industries, and I think delaying the onset of long-term conditions into later age will need a very different set of interventions going forward, and we're going to have to support patients in caring for themselves, and that's going to be increasingly something that all providers of healthcare will need to do. It will mean supporting self-diagnosis and management through phone and web services. It will mean helping patients make decisions and navigate the system through apps and decision aids and through accessible support. And why should we do this? Well, if you think about who lives with their health care conditions, it's patients. For most of the time, for most of their illness, it's patients who live with their illnesses. Over a year, a patient caring for themselves and their condition spends around just under 6,000 waking hours living with their condition. Yet they will only spend about 10 hours with healthcare professionals. So we need to harness that expertise and that focus and that understanding for the benefit of patients, and that's what I believe healthcare coaching is all about. So if you think about what's happening in other industries, as I've said, they now increasingly recognise the investment that needs to be made in helping, coaching people to look after themselves, do things online. We're going to need to move into that space where we increasingly invest in helping our patients look after themselves. So we're great at investing in staff, and I think that's testament to some of the things that Caroline has just referred to, and I think we could do more on that. We always could do more, but we do invest in staff. But do we invest in our patients? No, we don't. Has this transformation been happening in social care? Yes, it has. Has it been happening in healthcare? Well, probably not as much as it needs to. So few healthcare organisations, as I've said, would really invest in the patients in the same way that we invest in staff. We need to change that paradigm. And there's a real opportunity here, and an evidence-based opportunity. So you may or may not have heard of Judith Hibbard of the University of Oregon in the States, but she's developed a patient activation measure. It's a validated survey, and it scores the degree to which patients see themselves as a manager of their own healthcare conditions. Now here's a key finding. Patients with the lowest activation scores, that is, people with the least skills, the least confidence to actively engage in their own healthcare, they cost 8 to 21% more than the patients with the highest activation levels. That's costing 8 to 21% more than the patients with the highest activation levels, even after you adjust for health and health status and social status and other factors. So patients who are activated are significant predictors of healthcare costs. Or let's put it in, let's translate the research jargon. Patients who are more active and engaged in their own healthcare drive better health outcomes, place fewer demands on the health and social care system, and have a better quality of life. And that's captured in some of the healthcare costs that are calculated. So if we are going to develop activated patients, we need to understand both the skills, understand patients and families and carers possess, and we need to harness that. So I believe, and I'd like to say this is day 9 or week 2, that increasingly West Suffolk Hospital is going to need to invest in this future. We're going to need to invest in the development of new services and new skills, and we're going to need to better support patients and their carers and their communities and our communities in developing and managing their conditions. That is going to require a major shift in thinking. So we're going to need to think out of the box in terms of how we develop services. It's going to mean new skills and new roles such as coaching and motivational interviewing, and I'm sure we'll hear a bit more about that today. It's going to be about thinking about new ways that we socially prescribe, how we signpost patients to non-healthcare services to reduce social isolation, to encourage exercise, to encourage well-being. It means new incentives and new interventions to change behaviours, and we're increasingly seeing that in the healthcare space. And it means using things such as remote monitoring and technology backed up by case managers. Harnessing the great BT research centre that we've just got outside of Ipswich and so forth. There's some great local community assets, some great local community expertise. We really need to tap into that locally. But this is not just about the technicalities of how we move into the health coaching space and develop new roles and new services. It will also require quite a fundamental shift in the culture of the NHS and how we behave as healthcare professionals. And I think this is why today's conference is really so important, and this is why health coaching is so important, because it's about the culture change that will be needed to make the things I've talked about a reality. You probably all heard yesterday on the news about the National Bariatric Surgery Registry, and that's got nationally 18,000 weight loss operations in the UK, over 137 UK hospitals. That was over the last 4 years. So just think about that. So that's 18,000 weight loss operations over 140 or just under 140 hospitals across the UK over the last 4 years. So this is young people under 25 reaching severe levels of obesity who need help. They're getting super obese, and the way that we're addressing that is by increasingly intervening through surgery and operations. Now, bariatric surgery costs around between 10 and 20,000, 10 and 20k, or 9 and 21k if you want to be precise. That's per operation. To train 20 clinicians on health coaching costs £4,000. And you think about the army of patients that we can create, better managing their own conditions, taking personal responsibility for their lifestyles and conditions. That's got to be the investment that we have to make. On Sunday, after I'd gone to the remembrance service at my local church, I got chatting to the football manager of my local primary kids football team. He was 25 stone. He'd been told by his GP that if he didn't sort his weight out, he wouldn't be around next Christmas. He's got a few heart problems. He's got sleep apnea problems. And he got a little bit of encouragement, a little bit of coaching. He's just watching his calories, actually. At the moment, he's just been watching his calories. He's not cut out the beer he likes, a pint. He's not yet really got to the point where he's fully exercising. Over the last 7 months, he's lost 5 stone. He wants to get down to 16 stone. When he gets down to 16 stone, I'll encourage him to get down a bit even further. But he's set himself real goals. He's a plumber by background. He works at the military base now, and he's taken real control of his own life through encouragement, active encouragement by healthcare professionals. So let me conclude. I do believe that that we're clear of the challenge, and we've been clear of the challenge actually probably for about the last 10 years. The population is ageing, they're getting more demanding, they're getting increasingly sicker and more frail, but equally there are some that are getting more active but living with conditions that they could better manage. We need to develop new services to tap into the renewable energy that's out there, the expertise that's out there, the appetite that's out there in our local communities. We need to improve communication. We need to encourage people with long-term conditions to prioritise health. And we need to transform the clinician-patient relationship. I think the outcomes, the benefits are clear. Patients who are self-sufficient will be better satisfied, will have a better experience, they will be more confident, that will encourage compliance, that will encourage both healthcare professionals to further enhance their quality of life, and it will free up resources to improve health outcomes. But it's not just rhetoric. Last Thursday, I believe, we agreed with the CCG that we would take diabetes as a focus for integrated and preventative working and joint working going forward, that we would seek to improve health outcomes for our people, our population, our communities who have challenges and problems with diabetes. And we have set ourselves a goal of becoming not the worst in the country, but the best in the country on diabetes care. And our populations do and does deserve better. So we need to make every contact count. We need to know that every clinician is engaged and concerned with behaviour change. We need to embrace health coaching, and we need to build a vision for the future, or I would like to build a vision for the future that makes the people of West Suffolk the most activated patients in the country. So I hope you have a great day. Unfortunately, I can't stay for the whole day, but that's not because of desire, it's because I'm still on day 9, and I've still got a lot to do. But thank you for all that you do. Thank you for coming today. Thank you for making the time. It's really appreciated. You are the future, so go with gusto and get people engaged in this agenda, because I think it's the right agenda to be engaged in. Thank you.
Thank you, Steve.